Hi guys, we're going to talk about heat and cold injury today. First of all, a quick note from my previous video on PPE. That was the bare bone basics of PPE. If you guys want to see some more detailed videos put out by the CDC, check out those links below. It's definitely more than we need to be doing, but it's also good to know how thorough sometimes PPE procedures have to be. Okay. All right, so heat illness definition being either you're making too much heat or you can't get rid of the heat you're making fast enough. This ranges on a spectrum. You have things like heat cramps, which are mild, all the way to the other end of the spectrum of heat stroke, which is a medical emergency. I've listed here a couple of risks that can predispose people to getting heat illness, and being in the Army, wearing kit, stuff like that definitely can increase our risk. Prevention is pretty common sense. Hydrate, keep your electrolytes balanced, try to limit the sources of heat that you're exposing you and your soldiers to. Now, when you do have that inevitable heat injury, there are ways to treat that kind of go along with the physics of heat transfer and heat dissipation. I've listed those below for you guys to take a look at as well. So the presentation, we'll start with the mild form, heat cramps. You'll have some painful muscle contractions, but the main thing to note is normal temperature, normal vital signs, and no mental status changes. Heat exhaustion, you will have an elevated core temperature, but it's under that 104-degree Fahrenheit cutoff. You'll have more symptoms than with heat cramps. However, still, the patient is mentating normally for you, and the vital signs may show some abnormalities. Heat stroke is when the rectal temperature or otherwise gained core temperature is above 104 degrees Fahrenheit, and it comes with altered mental status, which indicates an organ damage. So there can be confusion, lethargy, maybe even a coma. They're just not responsive, and definitely other vital sign abnormalities as well. Some things to consider that might be contributing or underlying this heat illness presentation: common dehydration, electrolyte problems, cardiovascular disease can be underlying sometimes. A separate kind of issue, exercise associated collapse, we can talk about later, but not really associated with heat injury. And then other problems, brain, thyroid infection can also cause or worsen heat injury. All right, so treatment. First thing is if their vital signs are unstable or they're not responsive to you, you want to do your normal CLS or ACLS and evac them as fast as possible. If you do suspect a heat injury, you also want to lower their core temp as fast as possible. So that's not necessary for things like heat cramps because they have a normal core temp. Now, if they have heat exhaustion, you do want to do the ice bags to the core areas. You want to lay them down, elevate, do some IV fluids. Now, heat exhaustion, evacing is not always necessary. However, for heat stroke, it definitely is an emergency. So evac as fast as possible while cooling as rapidly as possible using the methods there that correspond with the methods of heat dissipation we discussed earlier. So ice water immersion, ice bags, fan for evaporation or convection, IV fluids that are cooled. And like I said, evac as fast as possible. Some associated complications of heat illness that will manifest, especially in the hospital when they're able to get more labs and such. You got acute kidney, liver, or lung injury or failure, rhabdomyolysis, which is muscle breakdown, and seizures, which is from brain dysfunction. So once they have endured the initial injury, what determines their return to activity? Heat cramps, like I said, mild, so they usually can go back pretty quickly, maybe 1 to 2 days. Heat exhaustion, also 1 to 2 days, but depending on how severe it is, they might need a gradual return to activity. This might take a week or so. Heat stroke is they need what's known as like a dead man's profile. They need at least 7 days of rest. They must have all symptoms resolved, and their labs also need to be normal, which can take several weeks. They definitely need follow up with a PA or doctor. And then they also need to follow a 2-week gradual return to activity in cooler conditions. However, if they experience more symptoms, they're going to need further testing. All right. This was my only reference. I got this from an old lecture from one of my sports med doctors. And that's about it. So in this next section, we're going to talk about cold injuries. Thank you.